Hello guys, welcome to my YouTube channel. So today we're going to see about uh, acidity. So most of about 90 percentage of the Indians are suffering from acidity as a side effect due to spicy foods, unhealthy lifestyles, and due to improper sleep, and due to workplace, and due to working in the IT companies. So they used to get acidity, and this acidity is very serious issue because it affects your lifestyle. You can't, after getting a gerd, there is no treatment. You have to maintain the symptoms. So that's the uh, very big thing about acidity. You cannot cure the acidity. It's not disease, it's just a symptom. So what happens is, due to the lifestyle modifications, we used to get fast food and eating more chocolate and more coffee and more improper sleep, improper exercising. And during those COVID periods, I have suffered from GERD. Uh, so first, when you get GERD, the most of the TV advertisement shows, you can take this with hot water. It will relieve the symptoms. You can see this is. I used this 2 years before. You can see the expiry date is 11/2021. It has expired, but it's still there in my room. I'm not using this one currently because this is fast acting. You know, it cures the symptoms within 30 seconds. It's true. It's it's with acts within 30 seconds because it's nothing but it's a salt. Like, it will suddenly decrease the acidity. That's the thing about this. But you should not take when you are pregnant. It's clearly written there. You should not for use adults and children 12 and years above. So you have to use weekly 2 or 3 times, two doses in 24 hours. That's how you have to use. And this is not preferable according to me, because as a medical student, I during my medical studies I used to use, but after studying that, then after going to my third year, I studied about this. This is aluminum magnesium. This is known as some. You can see most of your grandparents are using this one. This acts. This is a and aluminum. Both combined is available in this Deucoid APS. So it's act within 2 minutes. It does not re- uh, reduce the acidity. Once you take once is taking a biryani, then you have acidity. Then after 2 to 3 minutes, you will drink this 1 spoon, 2 spoon. Then you get relief. But next time you might get the same acidity. So it does not cure the acidity. It just decreases the acidity. And magnesium and aluminum has no side effects. Easily dissolvable in your stomach. And 1 to 2 teaspoons, 5 to ml, you can use weekly thrice. And this is very good medicine. But if you are going to get acidity weekly twice, then you can go with this. But if you are going to eat anything and you're getting acidity, then in the morning we have to eat pan 40, because after eating you're taking vomit. There is no use of eating itself, because in some patients, whatever he eats he vomits, and whatever he eats he get acidity. So that's the condition. Yeah, so most of the doctors use ranitidine. And before taking the fever medicine, you have to take the pan 40, which is like omeprazole, which is nothing but the chemical name is omeprazole. gastomeprazole resistant tablet. I have taken thrice in the morning, but this works. It's a wonderful drug. It has no side effects, I guess. It has least side effects. You can take for 50 years, but I can see less side effects. But no side effects for this. You have to take early in the morning, at before 30 minutes before the breakfast. And this drug does not cure the acidity. It just decrease the acidity level in the stomach. And if you have more than for 3 months, 4 months, it's very good thing you have to meet the doctor, and doctor will give this medicine. Because I have the same problem of getting more than 5 months acidity, and I went to doctor, and the doctor gave this medicine. And after 1 year of acidity, and it's my problem that I did not maintain my lifestyle, did not due to my work, due to my study, I did not sleep properly, does not take food properly. So then I consulted the doctor. Then the doctor gave pantoprazole. This drug is somewhat bigger than this drug. This drug is somewhat bigger than that pan 40. This is pan D. So sometimes the acid level may increase due to the peptic ulcer in the stomach. So this drug will do wonders in your. It will kill those bacteria which increase the acidity level in your stomach. And this, if this drug does not work, then surgery is the only choice. So most of them are using Google. You can search what are the treatments for GERD. There is no treatment for GERD. There is no medicines for GERD. Just for symptoms you can take. So this also taking for symptoms. Pantoprazole, gastroresistance, and omeprazole prolonged release capsules. So what about the special about this medicine is that this medicine does not work in the stomach. It goes to duodenum, and then it kills the bacteria till duodenum, and then your acidity level will decrease, and your bacteria which increases the acidity will also be decreased. So there is much more, so you cannot feel the acidity, but afterwards you are feeling acidity. It might be due to hiatal hernia, which is condition. The stomach will go up. and if you are facing GERD for more than 1 year, it's right time you should get consult your doctor about this condition of gastroesophageal reflux disease, GERD. And doctors will give these medicines, and will go to endoscopy, and they will say whether there is an possibility of doing surgery or not. And if you're taking the medicines properly, and if you are maintaining your lifestyles, exercising a day, and eating proper food. So you have to eat, should not drink more water. This is what I advice I will give. Should not drink more water once. You should take little bit, little, and you also take food uh, 5 times a day. Like, you have to divide the food into 5 times a day. You have eat little. So while you are maintaining your lifestyle, exercising, actually the weight will decrease, and the stomach will go down. And this video is not for pregnant is entirely different, because this is like medicine, that is gynecology, that's a separate different um, entity. And for pregnant, there is acidity, which is due to the baby is pushing the esophagus up, so they are getting acidity and nausea and vomiting, all those stuff. But I would say, so these medicines are not strictly prohibited, should be not used in you should not use in pregnancy. I don't know about this. You should not use in pregnancy. And if you are in pregnant, you should not use these drugs. You should throw away these drugs. You should use what your gynecology doctor is, your female doctor is saying. This is for males. This is especially for males. Don't confuse it. That's different topic we will discuss. And if you want to ask some doubt in the comment section, you can ask about acidity and gastroesophageal reflux disease. How can I maintain my lifestyle? How to take drugs properly? And what are the different drugs available? I'm sure this video will help you to get rid of acidity, which is known as gerd. So please subscribe my channel for more related stuffs, medical stuffs, and you can ask any doubt in the comment section. I'm ready to post a video of that. Okay, thank you.